Everyone wants to know, why is the flu so bad this year? More importantly, what can we do to protect ourselves? And we wanted to talk more about this, and in particular, we have someone on the phone to help us out from the Center for Disease Control, Dr. Angela Campbell. She's with their influenza division in Atlanta. And Dr. Campbell, thanks for being here.
Yeah, hi. Well, thank you so much for having me. I will say, although flu seasons vary, and most people who get the flu will have mild illness, we know that seasonal flu is such a serious disease that every year, unfortunately, we see hundreds of thousands of hospitalizations and tens of thousands of deaths. And it's in those older people, 65 and older, it's in young children, and people who are at risk for complications.
All right, anyone in the audience, if you think you have the flu right now,
leave.
But you were asking a valid question earlier, which is this concept of, yes, getting vaccinated is important, but protecting yourself.
Protecting myself. So first of all, like I'm a mom and I want to be able to protect my kids. Is there anything that I could do to protect my kids? Because they are going to school, they are exposed to all that. And then second, I travel a lot. I'm worried about myself as well because I don't want to catch something and take it home to my kids. Is there anything preventative that I could do?
Right. I'm a mom as well. I think, the single best way to protect your child and yourself against flu is to get the vaccine. I mean, that's why we recommend it for all people 6 months of age and older. That's the #1 preventive measure. Of course, there are other very practical things you can do. Wash your hands often, ideally with soap and water. If that's not available, hand gel. Cover your cough. Try to avoid close contact with people who are sick. I know that's difficult to do right now. Also, try to avoid touching your eyes and nose and mouth. That's something kids do a lot. So I think, those practical preventive measures as well as vaccination, I really can't emphasize that enough. We know that it does protect and it does save lives.
And yet a sobering reality of the influenza virus is that it's airborne. And so you can do everything right and still get influenza, and that's the case with any airborne virus. So that's why people just need to be aware. And
I mean, short of wearing a mask and a higher grade mask, it's almost impossible to.
It's also incumbent upon those of us who, if we are dealing with what we believe to be the influenza virus, look, that's a time you do not want to be going to work. You do not want to be getting on an airplane. You do not want to be riding public transportation because that's how these things spread. During the winter, we're in close quarters. We're all around one another. One person's sick with the flu. They're coughing. They're sneezing. It's airborne. That's where we all have to be in this together. The one thing I did want to ask you, what's your recommendation for individuals out there when it comes to, let's say they're dealing with the flu, because everyone thinks the first course of action should be just go to the ER, but usually that's not the case.
Well, you're right. I think, it is true that most flu is going to be mild and most people are going to be miserable, but they can manage that at home. The majority of people don't need to seek medical care, and the majority of people don't need antivirals. But there are some instances where an emergency room is clearly appropriate if someone has severe symptoms or if they don't have a provider. But in general, I think if you have a primary care provider who knows you, then it's really ideal to be able to call that office and make an appointment, particularly for people at high risk for complications. The people at the most high risk are children younger than 5, especially younger than age 2, adults 65 and over, pregnant women, and then anyone with a chronic medical condition like lung disease or heart disease. In children, a huge category includes those with neurologic or developmental disorders.
Well, Dr. Campbell, we certainly appreciate all the work you're doing at the CDC, and let's cross our fingers that we turn the tide on this influenza outbreak this year.
Not too late for the vaccine.